Hello, welcome to Rad Talk, the only show devoted entirely to radiography.
Today we will be discussing a groundbreaking new procedure in the field of radiology. It is called nephrotomography.
This incredible new procedure is an examination of the kidneys. It is in addition to an existing procedure called an IVP.
The purpose of an IVP is to see the kidneys and other urinary tract organs. It does this with the introduction of contrast media in the bloodstream. Often, though, the kidneys are obscured by material in the colon such as feces and gas. By moving both the X-ray tube and the X-ray film relative to each other, the radiologists can actually select a plane at which the X-ray picture will be most in focus.
In nephrotomography, the focal plane is set on the middle of the kidneys. The technologist often obtains a scout tomogram to locate the patient's kidneys. If the renal outlines are well visualized, the radiologist will get a few slices above or below the scouted plane. If they are not, adjustments are made. Most departments get their tomograms quite early in the sequence during the nephrogram phase, when the renal cortex is bright and lit up and the outlines are sharp.
This test is done to demonstrate any abnormalities in the kidneys. It can also diagnose renal hypertension and tumors or cysts in the kidneys. This procedure may sound scary, but is actually very easy on the patient and allows for faster diagnosis of certain urinary tract conditions. The exam will begin with a technologist interviewing you about your medical condition, and especially your allergy history. You may also be asked questions about your preparation. The preparation will consist of a liquid diet 1 to 2 days prior to the exam. The doctor may also ask you to take a non-gas-forming laxative the evening before the exam. The technologist will then tell you about the risks of receiving contrast material. Although reactions can be severe, risks are small. You will be asked to sign a consent form that affirms that all the risks have been explained to you.
Now, you are ready for your first film, which is just a KUB, an image of your kidneys, ureters, and bladder, taken before the dye is injected. This is a 14 by 17 film centered at the iliac crest. The radiologists want to have a record of what your abdomen looked like before the contrast is injected. You will be lying on your back on the exam table and the technologist will probably feel for a number of landmarks on your body, such as your hips and sternum, in order to obtain the best possible film. Then you will have dye injected intravenously. The contrast solution is a non-ionic, iodinated contrast called omnipaque.
Scout films are very important for this procedure. IVP exams require the injection of dye, so a record of what things look like before the dye was injected is needed. Also, if you have had a previous GI test, like an upper GI series or barium enema, residual material from those tests in your large bowel could completely cover important structures like the kidneys and make the test useless.
After the technologist has done the preliminary work and consulted with the radiologist, the dye will be injected by a nurse, technologist, or radiologist. Generally, IVP dye is injected by bolus, which means directly into the vein in large 50 cc syringes. You may receive up to 200 milliliters of omnipaque depending on your weight.
After contrast injection, you might have a flash of heat of varying intensity, you might get a bitter taste in your mouth, or you might feel nauseated and get the dry heaves. These side effects are usually minor and disappear quickly.
The tech will begin by measuring your abdomen with calipers. After the contrast is injected, the X-ray tech will take a series of X-rays of you. The images will be taken several minutes apart, as the dye flows into your kidneys. The X-ray tube will rotate to take a series of axial projections at different angles, allowing the kidneys to be viewed in slices.
The first slice will be taken at 1/3 of the thickness of your abdomen. Then slices will be taken 1 inch in either direction to cover the entire kidney. These are 14 by 17 films centered at the level of the kidneys. At 10 minutes, another KUB is taken. Depending on the protocol of the site, the doctor may order left and right oblique images of the kidneys. These are 30-degree obliques to bring each kidney parallel to the film. All these images are shown to the radiologist after 20 minutes. He may request another KUB.
After the radiologist has all the information he needs, He will ask you to go use the bathroom and try to empty your bladder as much as possible. Then another X-ray will be taken. This is called a post-void film. This will allow the radiologist to evaluate how well your bladder empties. This film is a 10 by 12 shot to include the bladder.
After the exam is completed, you will be allowed to leave the facility. The only thing you will have to do is drink a lot of liquids to flush the contrast media out of your system.
This concludes this segment of Rad Talk. Tune in next week for more information.